Okay.
Yeah.
Good morning, everyone. Welcome to this GP education event. I'm really pleased to see so many of you here because I know how busy you are in your practices. So to take the time to come here to learn a bit more about personal health budgets is really appreciated. And today I'm going to talk about the pilot we ran in personal health budgets, which is just concluded, and the future next steps we'll be taking to roll out personal health budgets. I'm Stephen Pruner, and I'm the Commissioning Manager for Continuing Healthcare and for personal health budgets. And I came to the pilot late because I just joined the CCG in December, and my predecessor set it up, but I concluded the pilot and I wrote the final report, and also I'm rolling it out very shortly. What I'd like to explain before I start into the slides is a bit of the background. So I'm going to switch this off and just explain that personal health budgets are relatively new to the NHS, and you probably know that as GPs working in the NHS. And it's all part of the personalization agenda, that we want to make services very personal to the individual and to give them maximum choice and control to choose the kinds of services that they think will meet their health needs. You may know that from October of last year, personal health budgets were available for anyone eligible for NHS continuing health care. So if you were found eligible for NHS continuing health care, you had a right to ask for that in the form of a personal health budget. What you will learn today is that from this month, from the 1st of April, that you will have a right to ask for a personal health budget if you have a long-term condition. And what I aim to do, starting from this month, is to put processes and systems in place based on the pilot that I'm going to tell you about in a moment, that will allow your patients to ask for a personal health budget if they have a long-term condition. So my first slide, I want to talk about the pilot. We recruited 6 GP practices, and 9 GPs became champions. And the GPs had the freedom to discuss with their patients personal health budgets and to work together to decide it was right for that individual. We didn't lay down any strict criteria. We allowed GPs to choose their patients they thought would be appropriate. So this is why the GPs took their own approach to selection. I think the key factor in choosing the right individual was motivation. So the patient had to have self-motivation, self-interest, and the ability to manage a pot of money and to go out and buy the kind of services they needed to support their long-term condition. And we set an indicative budget of £2,000 per individual, but we discovered at the end of the project that most people spent around £1,800 on average. This is what we learned from the pilot. We learned that GPs had a tendency to choose people with these conditions: fibromyalgia, depression, scoliosis, chronic pain, spinal injury. And those patients that did the best with the personal health budget had the highest what we call patient activation. This is the motivation to actually want to engage in this process. We found that the average age was 51, and most of the patients chosen by GPs were females. And here's a list of some of the things that patients spend their pot of money on. Acupuncture, reflexology, swimming, massage, health supplements, yoga, adjustable bed, dishwasher, hydrotherapy, meditation, scooter, personal assistance, hospital bed, and to pay for a carer. And my final slide is the next steps in rolling out personal health budgets. So from April, we're rolling it out to people with chronic pain, because we learned that from the pilot. That was the most common long-term condition. And we expect 160 patients in Islington, and that could cost us $410,000 a year for those 160 patients. We're currently developing branding for the rollout, and we will continue to use, as you may know, for those who were in the pilot, Islington Council's payment systems to deliver them. So we've looked at the pilot, we've looked at the next steps starting from this month, and I look forward to engaging with you as we roll out personal health budgets. Thank you.